Alrighty, hey, so we are talking about blood. Yeah, so we're building a playlist on blood, and at this point, we're helping you to understand RH factor basics. Alrighty, now, this RH factor, it can be really tricky because it brings up the discussion of blood transfusion and also issues between mother and fetus, right? So very key to understand. I find it hard to believe that you would take an NCLEX and not have this information on there. It's going to be on there. It's going to be on multiple exams while you're in nursing school. At the very least, it'll be in the maternity section, but it's also going to show up again when you're studying med surge. Okay? All right, so who am I? Cliff Davis, Associate Dean of Nursing and longtime advanced medical surgical professor. As a matter of fact, you can refer to me as a dual capstone professor, as I've taught at the RN level as well as the LPN level at the same time, Okay, all right, so what are we doing at RN Cliff Notes? Helping students to see through larger concepts by giving you what? Study smart strategies. And we've already addressed that. Study smart strategies are critical. Why? We want long-term comprehension. We want professional level comprehension. We don't want to study and then data dump and forget our information after we take the exam. That is no good, right? We need to know that information past the exam into the final, past the final into the exit test, our progression test, right? Past that into the NCLEX exam and into our professional careers. Isn't that right? Great. So now, we're numbering our paper or our device from 1 to 6. 1 to 6 this time. And we're jumping right in. Number 1, what is the origin of the letters RH? We throw that around all the time, right? When it comes to blood transfusion and things. RH factor, RH factor. But we want to know where it comes from. This improves our depth of knowledge, yes? All right. Actually comes from the study of rhesus monkeys. RH, rhesus monkeys, okay? So there's our little guys there. And so this RH system was first studied in 1940 by Landsteiner and Weiner. They were injecting blood from the monkeys into guinea pigs and rabbits and conducting the testing. And what they found, if the D antigen, right? If that's present, then the person is RH positive. If the D antigen is absent, the person is RH negative. Yes? Good. Now, okay, RH factor, all right, when they're positive, and then in terms of the previously stated protein, right, that's found on the surface of red blood cells, and as it turns out, 85% of the American population are RH positive. And can a patient with type A plus blood, right? So our patient's A positive, and the donor in this case is A negative. Ooh, can we proceed with that transfusion? Now, hold on, all right? This is really critical stuff because as a nurse, what you don't want to do is rely on anybody else. You don't want to have to rely on the internet, right? You don't want to have to rely on the lab. You want to be able to validate that information for yourself in terms of what you're looking at, if it's appropriate or not. Not, well, the lab said it's okay. So what, right? Right? I have a license for a reason. Is it okay? I'll let you know. Okay, yeah. So here we go. And yes. So our patient with type A positive blood can receive a transfusion from a donor who is A negative. And now, number 3, can a patient with A negative blood this time receive blood from a patient who is type A positive? And you say, just put down there, no. No, but we're going to get into that deeper here. Okay. Now, number 4. Now, instead of blood transfusions, let's relate it to mom and fetus, okay? Again, critical information for your exams. Okay? All right, can a mother who is Rh positive carry a fetus with Rh negative blood to full term? And you say, yeah, doozy, right? Yes, there's minimal risk under normal circumstances. Minimal risk. Okay? Now, 5, can a mother with Rh negative blood carry a fetus with Rh positive blood? Now remember, the fetus is growing inside of her. So, right? You should put down, no. Likely not without complications, as there will be a great risk for EF, erythroblastosis fetalis. Now, while that sounds like a lot of letter salad, right? It's actually a fantastic word, right? Definitely one you want to add to your repertoire, right? Erythroblastosis fetalis, right? Okay, so EF. All right, now, 6, what medication should the mother at risk of EF, what medication should she receive and when, right? That's key as well. When should she get it? And that medication is Rogan, R-H-O-GAN. And again, where the R-H from the medication come from? The name of the rhesus monkeys, right? And at 28 weeks, she should get that dose, right? 28 weeks gestation, and within 3 days of delivering her baby. Okay, now, hold on. Because we want to add a caveat, right? There are many of us who know of women who were attempting to have a baby, and they're like having multiple miscarriages. I just want this to be in the back of your mind, because as healthcare providers, we're still human beings, and sometimes we get caught up in the moment. It can be so sad that she lost her baby, but we need to keep our scientific composure, and we need to ask ourselves, right, in case it just, we're overlooking it because of the moment. Is she having multiple miscarriages because she's not getting this dose, right? We're maybe not paying attention to the fact that what? She miscarried, but what did she do? She delivered. She delivered her baby, right? So just keep that in mind, right? Are we missing that window of opportunity because of the emotion? We want to go ahead and discharge her to the comfort of her family, right? So they can console her. Yeah. All right. Yeah. All right. So here's the RH rule that I'm going to add in here, right? I'm going to approach it from 2 different directions. This first one, we'll see how it goes. All right. So RH rule. All right. The signs must come together without changing one another. That part is key. We want to be able to bring the signs together, and their general shape should not change. Or the shape of the patient's signs shouldn't change. Yeah? All right. So what are we talking about? This here. So if we have a person with a negative RH type of blood, and they're giving it to a patient who is also negative, right? Let's see. The shape should not change, correct? So if we take these 2 signs and push them together, would the shape change? No. That negative should fit perfectly behind the other negative. They come together and what? We're good. Now, what if the donor is negative and the patient is positive in terms of the RH factor? All right, well, if we bring those signs together, and this is our patient sign, yes, well, if we push the donor sign into it, what happens? The donor sign, negative sign, fits perfectly behind our patient's positive sign, right? Yeah. Okay, we're good. But now, what if our patient is negative and our donor happens to be positive? Oh boy. If we push those signs together, then It doesn't work. The donor's positive sign is going to change the shape of our patient's negative sign. Doesn't fit. Ah, okay. Now, this symbol can tend to help as well. So, it illustrates what we've been talking about. If our donor, right, so a donor, we start on the beginning of the arrow, and the patient will be at the arrowhead. Okay, so if our donor is Rh negative, right, and our patient is Rh positive, that works. That works. But if our donor is Rh positive and attempting to give to a patient who is Rh negative, that does not work. Remember, that changes the sign. Okay. All right now. But let's look at it from a different perspective right now. Unfortunately, this next perspective won't be as nice as these other ones were. Okay. But we're trying to learn, isn't that right? All right. So in this next scenario, RH, we're talking about RH, our health. Our health. And we're going to bounce it off of the idea of us potentially dating someone, right? So if you're dating someone, right, and we're concerned about our health, if they are negative for diseases that would affect our health, then we could potentially date that person, correct? Yes. All right. But if that person is positive for diseases that could impact our health, then no. Isn't that right? Absolutely. At least we hope not, right? Yeah. So you get the idea. All right. Like I said, it's a little different, but yeah. All right now. So here we go. We're gonna add on a little bit. Because we've been talking about blood. And you know me, right? Add on city. Start out at 6 or wind up at daggone 10, 12. Who knows where we're gonna wind up. Okay, so anyway, this is some concept that we're gonna address in a future video. Here we go. So what I want you to write down is the name of the CSF. Hold it. But this time we say CSF. We're talking about in reference to red blood cells. And you go, what? Yeah. CSF, colony stimulating factors. Oh, okay, so wait a minute. If the colony of red blood cells were deficient, right? Oh yeah. If the colony were deficient, what medication do we anticipate the doctor ordering? Hold on, not done with it yet. So that medication has 2 names. Let's put down both of the names, right? So we went to 6 in the video. So those 2 names will be number 7 and 8. So one name will be 7, the other one will be 8. Okay. All right, then let's make 9. We said if the red blood cells were low, I want the medical term for when the red blood cells are low. Okay? Good. Okay. And don't put down low red blood cells. All right, yeah. Okay, so now, so 7, I would expect you to put for either 7 or 8, epogen. Yes, epogen. Okay. And what's the other one? Right? Erythropoietin. You can say erythropoietin or you can say epogen. Good. So that's 7 and 8. All right. Number 9. Number 9, you should have put down erythrocytopenia. But I know there's some of you out there. Erythrocytopenia. Well, I'll put down anemia. We'll give you a pass this time. Okay. Just this once. All right. but erythrocytopenia. Erythro, right? What, the red? Cyto, cells, penia. Not enough, okay? Or insufficient. All right, great. Hey, thank you guys for liking and subscribing, especially you subscribers. Thank you for joining the tribe. All right, see you guys next time.